need a lot of help because they've never actually done the math. They don't actually know any of the numbers that I've gone through. Now, some really savvy practices will, and those ones are really fun to work with. That's why we analyze the data on the front end, so you can easily do this on the back end. But it's so important that we're using real data for that practice, because if we're just picking stuff out of the sky, then it's just kind of like, I don't know, maybe, those numbers were Chris's averages or those numbers were national averages. They have to be your averages. You have to believe it, that it's worth your time, and now you can just get to take care of the patient. Hello and welcome to the Chris Wolfe Podcast on iCode Media. Today we're going to talk about, well, first, happy Thanksgiving. This week is Thanksgiving week. And today what I want to talk about is what we call step 4 of Comprehensive Optometry Simplified. It is analyzing your fees. And the main reason we do this step is so that you understand the value of a new service as you're going to bring it into your practice. And the reason we do this, I'll talk about in just a second, but to summarize before we get into step 4. Step 1, remember, is figuring out the critical questions that you want to set up on your intake form. Step 2 is figuring out the process that you're going to follow related to a specific disease state. So what is the ideal that I want to follow for a patient with macular degeneration or dry eye or glaucoma, based on different staging and categorization of those diseases, based on evidence-based medicine. And then step 3 is, what documents am I going to need in order to articulate to the patient, documents and information am I going to need to articulate to the patient what's going on with them? And so that brings us to step 4. So please enjoy this monologue. As always, be sure to subscribe to the podcast, write a review, share it with your friends, and support those who support us. The most common questions I get include, what ophthalmological codes or evaluation and management codes should I use? What ICD-10 codes do I need to bill with this CPT code? What CPT codes can be billed together and what can't? And my favorite, how do I manage a patient who has diabetes who comes in for a quote-unquote routine eye exam? These questions really highlight the confusion and uncertainty that serves as a daunting hurdle for providers, makes it more challenging for them to care for their patients and provide those patients with the best opportunity for a lifetime of ocular health and clear vision. That's why we built iCode Education, for this specific purpose. Our mission is to provide optometrists with resources to help you understand disease states, revenue cycles, and billing and coding so that you can put that on autopilot and truly care for your patients. Check out iCodeEducation.com. That's EYECODE education.com. We've developed a premier billing and coding bundle that includes all of our billing and coding resources in one place. We also have a 10% discount code just for listeners of this podcast. Enter the coupon code EYECODEMEDIA22 at checkout. We'd love to work with you. Check out iCodeEducation.com. Hello, dedicated optometrists. Are you looking for a way to support your patient's vision and overall eye health? Let me introduce you to Vision Edge Pro, a visual performance supplement that stands out in our profession. Vision Edge Pro contains a balanced blend of mesozeaxanthine, lutein, and zeaxanthine in a 10-10-2 ratio. This combination has been scientifically shown to increase macular pigment density, which enhances visual performance, including contrast sensitivity and vision in glare situations. Additionally, Vision Edge Pro provides 300 milligrams of DHA and EPA, fulfilling the daily requirements for omega-3s as recognized by the leading health organizations. This ensures your patients receive the essential nutrients their eyes need for optimal health. Whether it's for everyday screen use, night driving, or enjoying the outdoors, Vision Edge Pro supports your patients in seeing their best. Recommend Vision Edge Pro for your patients today and help them achieve clearer, healthier vision. Contact your local Macu Health representative for more details. Vision Edge Pro, because your patients deserve the best in eye health. Go to macuhealth.com and use the coupon code PODCAST2024 at checkout for special discounts. Okay, so in step 4, what we're doing is we're updating our fees and billing and coding approach. And the reason we do this is so that we can remove the question mark about whether or not this service is worthwhile to provide for our patients. One of the big challenges as we consult for practices all over the country, one of the big challenges that we hear from providers is that this really isn't worth my time diving deep into, or maybe not that they're that outwardly thinking about that downside, but that what they'll say is that the amount of time it takes me to manage a patient with complex dry eye or glaucoma or macular degeneration, or even simple dry eye or macular degeneration, will detract me away from providing routine care, or not even routine care, but comprehensive care that leads to the sale of glasses and contact lenses. So the reason we do this step, and the reason it is number 4 and not number 1, is because 1, we want to be able to take care of the patient. And the reason it's important, however, is because I want to remove that barrier that is in the back of your brain. In most optometrists' brain, there's this little barrier in the back of our brain, and I go through, we can go through in detail in our Comprehensive Optometry Simplified course, and we do, why this is there. But ultimately, it comes down to the fact that the vast majority of the value that we see with managed vision care plans and with the historical aspects of optometry is we get underpaid for the services we provide so that we have the opportunity to sell a widget, to sell glasses and contact lenses. And so anytime we see a patient without the opportunity or the perceived direct opportunity for selling glasses and contact lenses, we view that as a service to the patient. We don't want to not do it, but we don't view it as a valuable thing for our practice. And so step 4 is to help us remove that barrier. It allows us to know for certain that if I provide this service, it will be worth it to the practice. And so then when I have a patient that needs one of these services, I never have to worry, is this going to be valuable for the practice? I know it will be valuable to the practice. And so that's what this exercise goes through. And so essentially what we walk you through, and what I want you to walk through if you're listening and you want to do this on your own, is I want you to walk through, all right, if I were to see a patient with one of my pillars, so let's say we picked macular degeneration as a pillar, and I want to walk through what's the financial aspects of managing a patient who has macular degeneration. What we would do is we'd start by figuring out what's your revenue per OD hour. We talked about why this is important in our analyze your data discussion, and we do that in step 1. But essentially what it does is it helps us know, okay, well, how much revenue am I generating for some amount of time? So just to go through some quick numbers, some quick math, if I have a practice, this is based on AOA national averages, is about $800,000 revenue, collected revenue per year for a solo doc. And if we extrapolate that out and we say that doctor is working 49 weeks a year, 5 days a week, 8 hours a day, that's about $400 per hour that they're generating in clinic. So that's kind of our benchmark and our baseline. And most of the practices that we work with, by the way, their performance is somewhere between $600 and $700 an hour. Usually right around $650 an hour with the practices that we work with an I-code. So they're already higher performing practices. So that means that this baseline is a little bit harder to get to, but we can still get there, and I'll talk about how we do that. So in any case, if we were to calculate the average, so you can run the reports, and you should have done this in your analyze your data section, but basically you would analyze your data and figure out on average how much revenue am I generating from the fees when I provide a comprehensive exam. So I can actually look at what I bill, like it's not what I charge, but what I bill and what I collect. And then I'd look at, okay, if I did 100, so let's say I do 100, let's say I do 10 comprehensive exams. And on average, I'm paid comprehensive exams and refractions. And on average, I'm paid $100. So some payers are going to pay me more, some payers are going to pay me less. But on average, I make $100 for that service. And let's say then that on average, again, I can show you the math on how this works out based on averages across the country that we have. But let's say that every time we sell a pair of glasses, we generate $300 of revenue, collected revenue. That doesn't include cost of goods; it's just collected revenue. So, and then also, let's say that 60% of our patients will actually buy glasses every time they have a comprehensive exam. So that would mean our capture rate is 60%, which, by the way, is a lot higher than the national average based on MBA metrics. That number is about 43%, but let's say it was 60% for easy math. What that means is that when I provide a comprehensive eye exam, on average, I'm going to generate about $100 in fees and $180 in sale of product. That's based on the capture rate and based on a $300 average sale of glasses. Now, again, I know we can make this higher. We can add contact lenses. We can add premium products, premium spectacles, but these average numbers are actually, they really apply across the country when you look at that. So my point here is we would look at your specific numbers so you would know what your baseline information is. So the bottom line is, on average, if I see a patient for a comprehensive exam and refraction and 60% of those patients buy glasses, that means on average I'm generating $280 per comprehensive exam. And if that took me 30 minutes, then that's the first time period that I want to consider. $280 for 30 minutes of time. Now, let's say that patient also had macular degeneration. Let's say it was category 3 macular degeneration. And let's say that I see that patient back based on our clinical practice guidelines in 6 months. We dilate them. We do a macular OCT, and that's all. Let's say we don't do a field. We don't do a red eval. We don't do a DAP-DX. We don't do anything else. Nothing else fancy. We just do an OCT. CooperVision and the AOA have joined forces in a groundbreaking initiative to transform how optometrists treat children with myopia. The Myopia Collective aims to unite our profession and its allies to challenge the status quo and elevate the standard of care for children with myopia. Everyone is invited to become a member of the collective. By joining, you pledge to act in slowing childhood myopia progression. Membership includes regular updates and information about the collective's efforts, access to educational opportunities and resources, and insights from the ambassador optometrists who advocate for community policy and changes supporting the collective's mission. Click the link in the show notes to join the collective today. We've been partnering with EssilorLuxottica 360 for a while now, and it helps us in 3 areas. First, they use social media campaigns to highlight products that we believe in and prescribe to our patients, and they deliver those patients back to our practice. Second, EssilorLuxottica 360 enhances our patient experience through staff training tools to help us simplify and streamline the way we communicate about our products and services. Lastly, but for my practice most importantly, it helps us make good business decisions related to our optical offerings. We will systematically and objectively analyze what our patients are purchasing and what they like, and removing products that our patients are not really using or not really drawn to. This, along with additional rebates and immediate savings, helps us continue to deliver high-quality products and services to our patients and keeps our practice resilient. Check out EssilorLuxottica 360 for yourself by visiting EssilorLuxottica360.com. And that would pretty much bring us, assuming that that's the only condition the patient had and it was stable, and we were just going to provide supplementation based on AREDS 2. So again, we can talk a whole lot about what supplementation you might want to use, but just using standard AREDS 2, which everybody can rely on. We've already said it's category 3, so AREDS 2 clearly applies. But if that's the case, then Medicare National Average would say that we're going to generate about $90 in fees for the 99213 and about $35 in fees for the macular OCT. And then also, let's say that we sell supplements in our practice, but our capture rate isn't as good, but those supplements generate for an annual supply about $300. And let's say our capture rate maybe 10%. So, I mean, you can get higher, but let's just say we'll pick a lower capture rate of about 10%. And if that's the case, then what I'm saying is that I'm generating about $156. So 30%, so $300, 10% of $300 is $30. So on average, I'm making $90 for the 99213, $36 for the OCT, and $30 for the supplements that will be sold in our office. And let's say that takes 30 minutes. That means that service is worth about $156 for 30 minutes of time. Again, we can play with this. If this isn't the amount that you need, you might say, and I think it's reasonable to say that, hey, if I'm seeing a patient with macular degeneration, I don't need 30 minutes. I can walk in, the patient's already dilated, they've got pressures, VAs, OCT. I've looked at all of that. I've got a scribe. I can do that in 10 minutes. Great. Maybe I can do it in 15 minutes. Fine. But 30 minutes, I think, is how a lot of people, when I look at practices, kind of a comprehensive practice, without being strategic with our schedule, most practices, again, and that's part of what we do within COS, is help you figure out where your schedule is lacking and try to fill those gaps. But let's just say that you don't want to do that. You just want to see a patient every half hour. then that patient's now going to generate $156 for that half hour of time. And that total patient's care for the total year that you're caring for them. And now it's just rinse and repeat. Next year is the same and the following year is the same. Then the total care was $280 plus $156. That's $436 an hour, which, by the way, on average is more revenue than what I had just laid out in the very first math that we did in the $800,000 practice of collected revenue that the doctor's working 49 weeks a year, 5 days a week, 8 hours a day, was $400, right around $400. So my point here is that as long as the sum total of the care you're providing for that patient, and you're following the ideal guidelines, as long as that number is higher than your original number, there's no reason to not provide that care. And now we can walk away at the end of the day and say, this is worth it. I'm going to do this. And now I don't have to worry about like, well, what if the patient doesn't buy glasses from me? We've already done the math. We know that our capture rate is 60%. Why would our capture rate be any less? We can make our capture rate better, or we can make our capture rate for supplements better. That's something we can play with and toy with, and part of what you can do within COS in terms of how you're going to talk to patients. But we already know it's worth it. So we never have to wonder about that again. We can just put it aside and take care of the patients. And that's why this is so important. Step 4 is so important because now it allows us to not have the little thing in the back of our brain that says, I wonder if this is really worth it. Or even worse, to say, this isn't worth my time, so I'm not going to do this. Now, the last thing I'll say about this is that you can do this math for every single condition. And I will tell you, you should. The reason is for exactly as I've just described. But a lot of people, when we go through this, we'll do these live courses and we'll walk through some of this stuff. And a lot of people sort of blank on this. They need a lot of help because they've never actually done the math. They don't actually know any of the numbers that I've gone through. Now, some really savvy practices will, and those ones are really fun to work with. That's why we analyze the data on the front end so you can easily do this on the back end. But it's so important that we're using real data for that practice, because if we're just picking stuff out of the sky, then it's just kind of like, I don't know, maybe, those numbers were Chris's averages or those numbers were national averages. They have to be your averages. You have to believe it, that it's worth your time. And now you could just get to take care of the patient. But again, you want to do this for every single pillar that you're creating or every single disease state that you're going to be integrating within your practice. And again, I can't stress this enough. It's so that you just get to take care of the patient and you don't have to wonder if it's worth it to support your practice. So I hope that was helpful. That is step 4 of Comprehensive Optometry Simplified. We work with practices to really get granular within that and make sure that it is working for them. And then we figure out if this is something that you want to do and you believe is in the best interest of your patients, but the revenue per OD hour is not adding up to what you're currently doing. Now we get to have fun because we get to see about how we're going to add new services or squash the time down that we're delivering those services so that it can be advantageous to the practice so that we just get to take care of the patient. So I hope this was helpful. I'll see you guys on the next one. Have a great Thanksgiving, and I will talk to you soon. Hey, if you enjoyed this episode, make sure to subscribe to us on Apple Podcasts and our YouTube channel, both linked in the show notes. Now, here's something exciting. We're giving away a 1-year subscription to Comprehensive Optometry Simplified. All you have to do is leave us a review on Apple Podcasts, take a screenshot, and email it to me at questions@icodeeducation.com. We'll put that in the show notes as well. We'll be selecting a winner on December 15th, so don't miss your chance to get access to this valuable resource. Thanks again for listening. I can't wait to see your reviews.